Right, but now we're going to be talking health. Dr. Kelvin Owusu is here, our resident doctor for Breakfast Daily, and he's going to educate us on an interesting condition this morning. Good morning, Doc.
Good morning, Kokri.
Always good to see you.
Good to see you too.
Thank you, thank you. Thanks for joining us, as always, to educate us on various health issues.
You're a health guy, no?
Yeah. I love it. Okay, so health guy, no?
Yes.
Today we're talking Hydrocele.
Yes, we are.
What exactly is a hydrocele?
Yeah, I mean the name doesn't seem to be related in any way to what it actually is. But hydro means water or fluid. So basically, a hydrocele is a collection of fluid around the testicles. Yes.
A collection of fluid around the testicle.
Yes.
Men, pay attention. This is all about you. Okay.
Interestingly, women should rather pay attention.
Really?
Because it's found mostly in newborn babies.
Oh.
Yes, and since most of the time, especially in the early days, the women are the ones who are closest to the babies. They should actually pay close attention. Of course, the dad should also pay attention because, well, it's your legacy, pretty much.
What? Let me tell you something. So, when we had each of my boys, my husband was obsessed with checking their testicles.
Yes. Very important.
And I used to say, leave the child alone. Why did he? He said, no, I need to make sure they're descended. I need to make sure. And I'm like, yeah, but if you keep squeezing them and all this, you're going to, So, but like you're saying, I think the men, as women, we may not realize or remember, we see the thing and we're like, okay, it's there.
It's there.
But the men know that there could be more to it. So,
True.
Dads, check your baby boys.
Yeah,
now important. I know why.
Yeah, so that, I mean, the testicle itself is surrounded or is encased in other tissues. Yeah. So some other tissues are around the testicle. So now there can be a collection of fluid within those tissues, so kind of like between your body and your shirt, there's some fluid in there.
Okay.
So that's what we call the hydrocele.
Okay.
I mean, I think we've actually had this discussion before. We talked about the fact that the testis actually begins in the abdomen, quite high up around the diaphragm area. So as the baby in the mother's womb, as the baby is developing, then the testes begin to descend. Okay. So that's why I can have a case where there's undescended testes. Now, as the testes are coming down, they might encounter some challenges, which is why sometimes they come down with fluid.
Okay.
So the fluid is not supposed to be there, but sometimes, there could be some separation. You see, nature abhors vacuum. So once there's a separation between the tissue that is supposed to cover the testis, something is going to occupy that space. And that thing in this discussion will be the fluid that we are talking about. So that fluid then surrounds the testes, and so it comes down into the scrotum with the testes as it's descending, And the good thing is that most of the time it resolves by itself.
I see.
Yes, most of the time it resolves by itself. So by the yes.
No treatment, like the doctor wouldn't have nothing invasive. You just wake up one day and it's gone.
Most of the time.
Okay.
It doesn't mean though that you don't report it.
Okay.
So most of the time, by the time the child is 1 year, it would have resolved by itself spontaneously.
Okay.
Because then, I mean, things would happen and the fluid will be resolved by the body, and then the layers will just appose. We call it appose, but it will close in English.
Okay.
It will close over the testicles, and then the baby is fine.
I see.
But it does not mean that when you notice anything wrong, you don't go and report, because there are several other things that can be going on in the testes as well, or in that area in the scrotum. You could have a hernia, you could have a varicocele,
more seals.
You see, and then you can then have a hydrocele. There could be an infection. These are all things that can cause the testes to look bigger.
Okay. So you don't know which one it could be. So definitely talk to your doctor.
Yes.
What can cause this?
So I mentioned that separation. If there's a gap between the testes and the layer, then the fluid would accumulate in there, but that's in the newborn.
So it's mostly congenital if it's a newborn issue.
Exactly.
They're just born with it.
They're just born with it.
There's nothing that the mother did while she was pregnant, or nothing hereditary. Is it hereditary?
Well, I mean, it can be hereditary because some sort of if your dad had it, the possibility that you have it is also there, but it's because most of them are self-resolving. It's not as big a deal.
Okay.
But there's always a but.
There's always a but.
It can also happen in adults or older children following trauma or infection. And here in the older adults, we are looking at infections like STIs. Yes. So you could have an STI, and as a complication of that STI, you could develop a varicocele, a hydrocele, as a complication of the infection that you had. Or you could have had a trauma, maybe somebody gave you a punch or a kick up the backside, and then the testes were involved, that could cause a separation, and then the fluid will then accumulate in there. Now, so obviously it's most of the time you find it in newborns, but it can also happen in adults or older children as well. So it's not just the newborn. So any swelling of the scrotum is important. You need to do something about it. The good thing is that, you know, older children and men are very, very concerned about their testicles. So if it happens in an older person, usually it doesn't get complicated. Okay. You know, because, hey, what's happening?
You'll notice right away something isn't looking right.
Exactly. And then they'll rush to the hospital and then get it sorted out. Okay. You know, but the newborn is quite important because the newborn cannot complain. And so that is why it's important that we actually focus on that newborn as well. You know, even though I did mention that it will resolve on its own, and so most of the time it's not a big deal, there's always a chance of complications. So the hydrocele can become complicated. You know. Now, I mentioned that infection can cause a hydrocele. Yes. The hydrocele can also be a medium for infection to spread. Okay. You know, because
I think we've got some images on the screen so people can see.
So you can actually see the fluid. The fluid is represented by the bluish coloring around the testicle. So you can actually see, in this particular case, it's encasing the whole testicle plus the epididymis and all of that. And then it would usually end at something we call the inguinal canal. You know, the inguinal canal is where the testicle, when it was descending, the place it passed through to come into the scrotum is the inguinal canal. And most of the time, the hydrocele will end there, you know, because it's kind of sealed. But sometimes it will communicate with the abdomen. So then in this case, when the baby lies down flat, the fluid will disappear. Oh. But when you raise the baby up, the fluid will come back because there's a communication between the abdomen and the scrotum. You see, now the reason why we don't necessarily want fluid in the scrotum is that the testes are hanging outside for a reason. They need some a lower temperature than your body temperature. So that's why the testes are hanging down there. You know, so anything that will compromise the temperature in the testes, we don't want. In fact, even the kind of clothing you wear can cause problems for your testes. Hey. Yes, because that's why I started by saying that it's hanging outside for a reason. For a reason. And so if you wear clothes that are going to push the testes back into close contact with your body, it's a problem in the long term.
So the tight jeans, the tight briefs, the tight underwear that men wear sometimes.
And even some men have started wearing nylon underwears. Oh my goodness.
Oh.
Anyway.
Or it should be cotton, breathable.
Yes, it should be. There should be circulation of air in there because that will keep the temperature optimum for the functions of the testes, you know, and the function of the testes is basically what makes you a man. So if your testis is not producing enough testosterone or is not producing enough sperm, it's going to cause problems, and you need optimum temperature for all those functions to happen. You know, so that is why we don't want a hydrocele to be sitting there, because it will compromise the temperature. Even though there's no direct link between hydrocele and infertility, because of the complications that a hydrocele can result in, such as infection, such as even hernia, because of that communication I mentioned, it can become a channel for abdominal viscera or intestine to come in there. You know, hernia basically is intestine that has found itself in the scrotum. That's a hernia. You know, so now there's already a communication there where the fluid is going back and forth. So it means that over time, the intestine can also pass through and then become, and that's a hernia. So the hernia now comes in with a further increase in temperature. You know, so all that can compromise your maleness. Okay. Of course, the varicocele, I keep mixing them up. The hydrocele can also become much larger. You know, so you can see in this picture that if you compare to the first one was smaller and it's getting bigger and bigger. You know, so if it's getting bigger, you need to do something about it. So even though the child is a newborn and that's not you're not going to sit in a house and say that it will resolve by itself. You need to go for a checkup so that the doctors will examine, probably do a scan to see if this is indeed a hydrocele, and then they'll monitor that child over the period. If it's getting bigger, they may intervene. If it's not getting bigger, they will observe. So that if after 1 year it is not closed by itself, then they may have to intervene and close it, you know, so that it doesn't cause problems. Because like I said, it can be a source of infection, and you don't want infection in the testicles because it plays such a vital role that you want to protect it as much as possible.
So if you're going for your regular, you know, postpartum checkups with your child, the pediatric appointments, that's something that should be picked up on? Yes. Or do they examine, I mean...
They should. I mean, technically they should. So first of all, when the child is born, there's a newborn examination that every baby should be taken through, and that includes examining the testes. Are both testes descended? You know, because again, not all children will have their testes descended at birth. You know, so if the testis is not descended, but then you can feel it along the line of descent, you want to then observe it and give it a couple more days to up to about a year, to make sure that it actually descends fully. You know, if you cannot palpate, or if you cannot find it along the line, then you want to do a scan to see if it's somewhere along the inside of the body, you know, in the abdomen. You know, so if you don't find it, it's a big deal. You have to find it. You know, God gave us testes for a reason, and there are 2 of them for a reason. So if only one is in the sac, you must trace the one that is not in the sac, because that one that's not in the sac can cause a cancer. So you don't want that. So when the baby is born, we have to examine all these things, make sure they are there. And then if they are not there, you have to educate the parents about it so that they know what to look out for over the next, you know, whatever duration that we are going to give them for follow-up, so that they can observe it. Now, the thing about the varicocele is that, like I said, sometimes when the baby is lying flat...
Hydrocele.
Sorry, hydrocele. Maybe we should talk about varicocele next time.
Next time we'll do varicocele.
So varicocele basically is a similar thing, but this time it's blood, not fluid.
Aha. Okay. So today we're dealing with the fluid, the water-like fluid.
Exactly.
Next time we'll deal with blood.
Yes.
Varicocele.
So, varicose vein. Varicocele.
Okay.
So yes, it happens in the scrotum as well.
Okay.
So if you know, I mentioned that when the child is lying flat, it might not be there.
Yes.
You know, but when the child is picked up, you might find it. Now, sometimes, because most of the time the baby is examined lying down, somebody may miss it. You know, but if you let the parent know that in case you notice anything along the line, you can report back to us, and then we'll do this and that about it. It helps calm them down, because you suddenly wake up one morning and your child's scrotum is big. Yeah. It can be alarming. You know.
Okay, but let's say you've got a child who's on the brink of puberty, right, or entering puberty, and they wake up in the morning and their scrotum is large. Maybe because could it just be additional sperm production or something, or is it necessarily time for a parent to panic, or could it just be he's growing, he's puberty, he's maturing, he's got some sperm that's coming up, you know? So when should that be cause for alarm?
You see, during puberty doesn't happen overnight. So you're not going to just see a sudden explosion in the size of the testicles, you know. Yes. But over time it grows, you know, gradually. Okay. You know, so when you see a sudden change in the size of the testes, you want to definitely know what's going on.
Yes.
Because it could be something as dangerous as a torsion. Testicular torsion is something that we do not want at all, because that literally means that there's no blood going to the testes, because the testis has turned on its blood supply, you know, and so it means that the blood is not able to go through, and that's extremely painful. It's swelling, it's painful. In fact, no, it's not just painful, it's excruciatingly painful.
Wow.
You know, and so we don't want that to happen at all. And if you don't get to the hospital early enough, they have to literally chop off that testicle and throw it away because it's dead.
Oh!
Yes, and so that's not something we want at all. So if you notice a sudden change in size of your testicles, you want to go and have a look at it and see what's going on.
This is serious. You know? Okay, so we need men, just look at your balls, please. Just examine them frequently, regularly, and carefully, so that you do not miss anything.
I mean, just as we said about the breast, that the breast is yours. Look at it. The testicle is also yours.
Yeah,
look at it, examine it. You know.
This is your health and your wealth, okay? All right, so we're talking hydrocele with Dr. Usu, and he's educated us a lot. I mean, seriously, as a mother, when I go home, I'm checking all my kids, all the boys, you know. I would tell my husband, have you checked your, thing lately? Just to make sure that nothing strange is going on. And something you said that's very important as well. I mean, if you're a guy out there and you know you're having your fun, use protection, test yourself, because STIs can also cause hydrocele or can get you in trouble. And wear cotton underwear.
Very important.
Ditch the nylon. Don't be fooled by silky looking underwear. Nobody cares. Wear the one that's good for you, okay? Cotton breathable.
Very, very important.
Very good advice, Doc. I like it. Okay, now, with regard to hydrocele, is there anything you can do to prevent it?
So, in terms of the newborn hydrocele, you cannot prevent it. If it's there, it's there. So you have to monitor it, observe it. If it's getting bigger, report back to hospital. If it's not getting bigger, continue observing it. But there's a deadline of 1 year. If it has not disappeared by age 1, something needs to be done about it. So you have to report back to hospital, and then they will refer you to the appropriate specialty, and then they will close it as appropriate. But before 1 year, there's no need to intervene.
Okay.
There's no, and this is important, there's no medicine that you take that will cause it to close. So don't walk around be looking for medicine to buy to deal with your hydrocele or whatever it is. In fact, let me broaden it.
Okay.
Hernia cannot be treated with medication.
Doc, please say it again.
Yes, you cannot treat hernia with medication. If you have a hernia, it has to be surgically closed. Several people are walking around with hernia because they are taking medication to try and close. It's not, you have a hole that's the thing is passing through, the intestine is passing through. There's no way medicine will force this thing to close. It's not going to happen.
But you see these people advertising.
That's why I'm stressing on it.
And, take it. It cures, and that medicine cures everything. It cures hernia, stomach ache, headache, loss of hair. You're saying it doesn't do anything?
No.
Wow.
So you have to, because the biggest confusion is this a hernia or is this a hydrocele?
Yeah.
You may not be able to differentiate the two. So you have to come to a professional. Then we know that it's a hernia or it's a hydrocele. If it's a hernia, if it's big, it needs to be repaired. If it's not too big, we might observe it for some time. Hydrocele up to 1 year, then intervention would be started. So you have to, once you notice any abnormality, especially in relation to the scrotum, you want to report to hospital immediately as soon as possible.
So no medicine to cure hydrocele. Is there any medicine that can cause a hydrocele as a side effect?
Not really. Particularly. It's like I said, it's just a complication of the movement of the testes from the abdomen down into the scrotum. It's just one of those things that it didn't close properly, so there was some fluid that was able to escape into that place. But over time, it closes by itself. If it doesn't close by itself, then we have to close it. However, in the older children, I mentioned trauma. Yes. So again, no aggressive play, or if you notice if somebody kicks you in the nuts, as they say, report to somebody. Okay. Or if you're not going to report because you are shy, at least observe the place and make sure that there's no complication. But once you notice any complication, you have to report. And for the older guys, the STIs can cause hydrocele, so you don't want that complication. So use protection, as you said, the ABC: abstain, be faithful, or use a condom.
Okay. William in Dansuman says, can a child have both hernia and a hydrocele?
Yes, you can. I mentioned earlier that because of that communication, there's a communication between the abdomen and the scrotum. Yeah. Most of the time, that communication is closed off, but sometimes it's open. So then the fluid goes in and out, which also means that intestine can also move in and out. So the two of them can coexist at the same time.
Okay, all right, good. Watching you live from Tema Community 2, that's from Donald Frank. And Asampana Rocky says, watching you live from El City in Bongo Bolga. You guys are too much. He's enjoying the conversation, and I'm sure he's learning a lot listening to you, Doc.
Thank you very much.
So the big point is, watch your testicles, make sure everything, touch it, touch it, feel it, watch it, all of the above. Make sure everything is good. And if anything looks bad, go to your doctor.
Very important.
Don't wait.
No, don't wait at all.
At all. Protect the crown jewels, the family jewels. Doc, okay, here's another question. Franklin, Accra, Newtown, do all hydroceles require surgery?
Well, it depends. Like I mentioned, newborns, we are not going to do any procedure. We're going to observe it, but if you notice that it's getting bigger, then we might intervene before 1 year old. But if it's not getting bigger, we'll wait until 1 year old, because most of them will resolve by itself by the age of 1. After 1, we might have to intervene and then close it up surgically.
But for the adults, let's see, the men...
For the adults, it depends on what caused it. So if the cause is trauma and there's probably a tear or something, depends on how big it is. If a tear is just like a cut might heal by itself, or you might have to suture it. So it depends on the dynamics of that particular tear. If it's caused by STI, question would be, has the STI been completely treated or properly treated? Because you don't want to go and do any surgical intervention when there is infection. So you want to make sure you treat the precipitating cause first.
Wow.
Then afterwards, if it doesn't resolve, then we may have to intervene, because like I mentioned, we do not want any situation that will cause an increase in temperature in the scrotum. So if it is still persistent, we may have to go and close it surgically. And
if after any surgical intervention, everything still works, right? It shouldn't affect the mechanics.
You see, as a doctor, we never say never. But the probability that something will go wrong is very minimal.
Okay.
But it's always there.
There's always that risk.
Exactly.
Slight risk. Okay. Why does hydrocele increase in size? This question is coming from Henry in Tema.
So I mean, it can increase in size, because if for instance, if your shirt is bigger than your person, it's going to show, depending on as you put on weight, you can still wear the same shirt.
Okay.
Do you understand? Now, remember that the tissue around the testis is elastic. It's
expandable. It can.
It's expansile. Yes, that's what I'm trying to say.
That one is technical speak. But, okay.
And so if as more, when the fluid stays in there longer, it expands more. So then more fluid is able to go in there, especially if there's a communication between the abdomen and the hydrocele.
Okay.
You know, or if the hydrocele is complicated by a hernia. Hernia is heavier, so when it comes in there, it's going to expand it some more, which means that more fluid will now come inside. So all these are reasons why the hydrocele can get bigger. And also, I almost forgot this one. If the hydrocele stays too long, the testis itself can become atrophic, which means that it's actually
it will start to shrink.
Exactly, because the weight of the hydrocele will compromise the blood supply, so the testis will start to shrink, which then means that the testis is smaller, so more room for the fluid. So yes, this is a very important complication I almost forgot. So thanks for that question. So that is why you don't want to entertain a hydrocele. If it's not supposed to be there, it needs to be you need to get it out of there. You know. So after 1 year, we want to intervene because of this atrophy. Atrophy is more likely after 1 year, so we don't want it at all.
Jake in Afienya says, who should be consulted to treat a hydrocele? Should it be your regular GP, or do you need a specialist, an andrologist? Like, who do you talk to? So
the GP is usually the first point of call, but the specialists who handle this are the pediatricians and the pediatric surgeons. You know, so pediatrician, or more specifically pediatric urologist.
Okay.
So, but
for adults,
you then go to your urologist. But again, you start from the GP. Everybody starts from GP, and the GP will refer you to your urologist, and then they would, or genitourinary surgeon, then they would then take it over and then do the final interventions.
Okay, Doc, I'm very glad you treated this topic today, because every man in this studio is paying rapt attention.
I can tell.
And all the messages are coming from the men who are watching. Usually, you see, they don't send messages. Today, because you're talking about testicles, come and see the men. They are watching and sending messages. Men, you should pay attention, okay? Watch the health segments all the time, not just when they're talking about your testicles, okay? There are other important issues we have to talk about. Thank you, Doc. And how do we reach you?
I'm active on social media, Kelvin Owusu, MD.
As always. Thank you, Dr. Kelvin Owusu, our resident doctor. A doctor guy, no? Yeah. But this has been a great topic. Hydrocele. Check your testicles, take a look at them, make sure they're as they normally should be. Anything strange, run. Don't even walk. Run to the hospital and get them checked, okay? We'll be right back with entertainment.